So what the urologist told me was the individual cannot give themselves an infection because the bacteria that's on their own skin is, your body's used to it. You can't give yourself an infection. So you just want to wipe off the just residual anything. So I'm going to use the 99.9% germ killer wet one. I wear loose pants. Then I take my wrists. I add pressure to the tube. Then it automatically holds onto it. So you don't have to worry about that. And then you can get ready. And I hold. Take one hand. All you need is a very little pincher grip. And because this is a sterilized catheter, you don't have to worry about anything. You just have to hit the hole and go. And then it'll go into the bag. And truly, the most important thing of the whole process is just making sure, like when he gets in his chair, like when you get in your chair, that you're not sitting on your junk. Like make sure everything's pulled up and sitting on top of your lap so that you're not trying to fish for it, which I don't know why anybody wants to sit on their balls anyway. Yeah, so this does take a little longer. It's almost like the bag is vacuum, it's like vacuum sealed, and it is a smaller French catheter. I think it's like a 14. So it's weird. So what actually goes in to the bladder neck and through the opening into the bladder is a smaller than what we normally use. So I think it's like a 14 or a 16. But then the outer one is bigger than what we normally use. So one's like a 12 or, I don't know, I think they're, yeah, on the thing I can tell you. If my eyes work. Oh, here it is. Yeah, one's a 12 and one's a 16. So yeah, and the 16 looks like it'd be too big, but you know, or uncomfortable. It's really not. And at night I have a bed that I can put the backrest up. So I have these on a bedside table, and I have side rails. You want to rotate to my bed? So I have a side table, and I have the side rails on my bed, and then I just use the articulating backrest to put my bed up, and then I grab my, you can come back together. And then I just sit up, cath and I put it in a garbage can. So sometimes I can get it on the edge, but at night, like during the day, I usually get it on the edge. At night, I don't worry about it. As long as I get it in the can. So then, just gonna come out slow like you do. As long as you go against gravity, you pull it downward, it's gonna just suck it right out. Same thing. This will be the. This will be the tricky part, is getting it back in. You just push that back in, do your cath, hook it on the side of the trash can. If you want to take it to the if you want to take it to the to the bathroom, you can. There's like these little hooks to put it in, but there is a little pull tab right here. And what I normally do is I just grab it, peel it with my teeth, then I'll pull it right off, and you just dump it in the toilet. But if you have someone to help, then you can just leave it there.